Hi, I'm Dan Stradford, the president of the nonprofit Safe Harbor and our website alternativementalhealth.com. Our mission is to educate the public, the medical field, and government agencies about non-drug treatments in mental health. Many people come to us asking us how to find alternative treatments and the practitioners who use them. This video discusses that topic. How to get alternative mental health help. First of all, when you first get into looking for options outside of taking medication, it can be very confusing. There are so many alternative approaches on the internet, for example, that it can be confusing. There is actually some organization to this. Once you start to learn about it, you'll sort of get some order in it, but there is still a lot of information out there and a lot of options. So we want to help provide you with some guidance and sort of coming to see which direction you want to go in. First, you want to learn about your condition, and we're going to discuss that at length in a few moments. In fact, each of these points we're going to discuss. You want to read some articles, you want to read books, you want to find a practitioner. This is somebody who can help you. Not everybody necessarily will need a practitioner. Some people with mild situations can do things on their own. We are, on a rare occasion, we'll see somebody with severe situations who do things on their own, but generally speaking, it's good to have some help from a practitioner. There are videos on the internet, many available, that can be of help, and these are especially helpful to people who might not be able to read too much, because sometimes if you have a severe mental disorder, you can't really read a lot, and videos can be a good substitute. Searching the internet is very helpful, and there's lots of data there. Also, the big thing is do not give up. We've talked to many people. We've been around since 1998, and the thing that people have in common is they don't quit. If they fail to find one thing that helps, they pick themselves back up and try something else. And sometimes it's the third or fourth thing that you find that really makes a big difference for you. So it's very important to not give up. One of the most important things you can do, in fact, probably the most important thing you can do, is learn about your condition. You may have been given a psychiatric diagnosis, and this can be helpful, but it can also be harmful, because sometimes, let's say you were given a psychiatric diagnosis of bipolar disorder. Well, that can be helpful because you're kind of identifying that you may have a manic experience where you're very active, and then you've got periods where you're very depressed. So you can kind of identify maybe what's going on, but it can also be harmful because it doesn't really tell you what's wrong, what you need to fix, and it also can maybe make you feel labeled like you're not really quite as valuable as other human beings because you're now a bipolar, and this is sort of a lesser person. So these labels can be have a negative effect as well. Learn to use it as something that use what you can out of it, and the rest of it you can leave behind if you need to. The whole point of it is that you want to do is you want to learn about what's actually going on with you, not what label you have. There are many physical problems that can cause these symptoms. We have right here depression or anxiety or child behavior issues, psychosis, and that sort of thing. Learn what these are. They learn what causes the symptoms that you're having. Maybe you don't have those conditions, but it's very helpful to see what they are. You can also do an internet search for causes of, for example. This will help you to look for we'll look and find what might be causing these symptoms. It's very helpful to do an internet search for that. Research on how others have treated these conditions without resorting to meds. That's very useful. Also, you can do a search for integrative psychiatry, alternative psychiatry, orthomolecular psychiatry. These are all names for alternative approaches. Orthomolecular has to do with nutritional treatments in psychiatry. So if you do searches of those, and under the condition that you have or the symptoms that you're having, you can also get some information. Do what you can, again, to learn about your condition, and as long as you have that condition, the more you learn, the more likely you are going to be able to control it and to maybe even eradicate it. Read articles and books. There are lots of articles on our website at alternativementalhealth.com, and there are many other websites that have information. You just need to look. One of the good sources of information is greenmedinfo.com. This is a source of alternative treatments, lots of medical articles on there for various symptoms. There's also you can search the internet for terms like natural treatment for anxiety, for example, or natural treatment for depression, and you can find a lot there. You look for alternative treatment for or non-drug treatment for, and those will also give you some good web pages to look at. There are lots of really good books on non-drug treatments for all types of mental health issues. If you search book sites for this, you can use the same terms as above: alternative treatments for depression, natural treatments for anxiety, that sort of thing. You will find books on these subjects, even severe mental issues like schizophrenia or psychotic disorders. You can find books on them that have alternative treatments. There are some classic books that have been around for years, or actually there's a newer one, hasn't been around quite as long, Nutrients Power. That is by Dr. William Walsh, but the data in that book will be true for decades to come. It's just a basic understanding of the nutritional triggers behind most mental disorders and how to treat them. So that's a very good book that will stand the test of time. The book The Mood Cure by Julia Ross is about amino acid for mood problems, anxiety and depression, and what is labeled as ADHD uh, or attention problems. That the Mood Cure helps you understand how to treat those. Natural Healing for Schizophrenia is another well-known book, and it's got another guide called Natural Healing for Bipolar Disorder. Both of these were written by Eva Edelman. Lots of technical information on how to treat these conditions and what might be causing these symptoms. If you're going to find a practitioner, there are many ways to do this. One of the reasons we started our website was because there was no or very few places to find practitioners. So we started a directory online, and since then there's been a lot of directories added for mental health resources. So you can go to our practitioner directory at alternativementalhealth.com. We do not charge to have these listings. In fact, none of these that I have here charge to have listings, so many doctors sign up. ACAM is another organization. You do have to be a member of ACAM, which is acam.org, in order to get listed there, but that's a list of many doctors around the country and around the United States, and a lot of them internationally too. By the way, our website has some practitioners internationally as well. ACAM is an organization of doctors that use natural treatments and health in general, but it includes many who treat psychiatric disorders. The American Psychiatric Association, interestingly enough, has a caucus on integrative psychiatry. Integrative means combining standard psychiatry with alternative approaches. And so you can find many practitioners on that website given right there. And the Walsh Research Institute, this was based on Dr. William Walsh's work, and it has a directory of people trained in what we call the Walsh protocols, and these we'll be talking about those on other videos, or you can find out about them on our website. A very important method for treating pretty much all types of mental disorders. You can get that information at the Walsh Institute's website right there. There's a website called integrativemedicineformentalhealth.com. You can get a list of people there who treat mental issues. And then there's orthomed.org. This is for orthomolecular medicine. And these are practitioners who treat medical and mental health issues with nutrient treatments. You want to find a practitioner that fits your needs. You want to know what you're looking for. Are there certain treatments that look best to you? And you want to get a practitioner, ideally, that has experience with cases like yours. There are lots of them out there. You'll be surprised when you start looking, especially now. There are a lot of doctors who treat depression, for example, alternatively, or anxiety, or even you find many who treat psychotic disorders. You want to ask what treatments are used by the practitioner. You want to find out if the practitioner uses meds and under what circumstances. You may want to stay on meds, or you may want to cut down on your meds, or you may want to not take meds at all. There are some practitioners, medical doctors, who try to not use meds under any circumstances, and then there are others who try to use them judiciously. And of course, many patients come to them on meds. They can't just take them off immediately, and so they have to use meds while the person is being treated to try to correct their symptoms without the meds, or before taking them off meds. You want to find out if the doctor, if you're interested in getting off of meds, will that practitioner help you wean off meds? Many psychiatrists will not, but you can find, if you're looking for an alternative practitioner on the sites that I gave you before, you're more likely going to find a practitioner on those sites that will help you with this. Of course, insurance, whether they accept insurance and what other payment options is important to find out, whether they accept Medicare, if that's what you have. So you want to ask about that. And naturally, location, what their availability is to you, and whether they have access to phone consults, whether they will do phone consults, which sometimes is important to people in remote areas or who want to talk to a doctor or practitioner who's very specialized. They might want to do a phone consult if that doctor is in another state and they're not immediately available to them. We have a basic recommended approach that we have developed after many years of working in this field of non-drug treatments in mental health. The first thing that we suggest is getting a full searching history, and this is done by a practitioner normally, and a medical exam. The reason is because if you've got something, if your symptoms are being caused by a medical issue that you don't know about, it's kind of pointless to go on to other approaches or to try to treat the symptoms in other ways, because you've got a medical problem. And if you've got a thyroid issue, for example, which is really quite common, or you may have Lyme disease, or you may have, there's a liver disorder called Wilson's disease, which can cause psychiatric symptoms. Many medical issues can cause psychiatric symptoms. So if you've got something like this that's causing your symptoms, you want to have it found out and corrected, because that could end the matter right there. And also that will help take it off your mind if you're wondering if you have a medical issue. If nothing is found on the medical issue, or if the medical issue is not the only thing that's causing your symptoms, if you do find a medical problem, then the next thing we suggest is full testing per the Walsh protocols, as we call them. These can be found at the walshinstitute.org website, that site, that URL that we give right there. There are various conditions, and you can look these up on the site. We actually discussed these in other videos. They're called overmethylation, undermethylation, pyrrole disorder, and copper zinc status. These can affect mental health dramatically. In what we have, from what we have learned, I would say more than 80, or possibly more than 90% of people with serious mental issues have some of these issues going on. The next thing you want to do is simply get treatment based on what you find with those two things, with the searching history and medical exam, and with the Walsh protocols. Now, it's possible that you may not be able to fix everything with that, and then you might need to do some other things. Or while you're treating those medical issues, or while you're treating those conditions such as methylation issues, you may need to do some symptomatic treatments. Treat these symptoms until the supplements work, or until the Walsh protocols are treated with nutrients, nutritional supplements. So it may take a while for the supplements to work or for your medical condition to start going away. You do some treatments. There are other supplements that help treatments. There are herbs. There's lifestyle changes. There's exercise. There's yoga. There's meditation. There's many things. Acupuncture. Many things that can help you feel better while you're getting treated. And of course, once you get the symptoms under control and um, your the causes of your symptoms are being treated and you're feeling better, then you can talk to your practitioner about doing some med withdrawal. Then you can start, I'm not saying you want to, you may not want to, but then you can, if you wish, start withdrawing from the medication that you've been taking, but it should be done under medical supervision. Videos. There are other videos in this series, and you're certainly welcome to see those. You can go on YouTube and search alternative treatments for or natural treatments for anxiety or depression, whatever it is you're interested in. There's integrative mental health. You can look for integrative psychiatry and similar terms. There are other video sites besides YouTube that have videos on them. You can search those. There are also there are videos at the Walsh Institute website as well. There are numerous internet sources where you can find information. Of course, one of them is our website, alternativementalhealth.com. There is the website called Integrative Mental Health. This is a nonprofit, and they offer information on non-drug options. If you're looking for assistance with OCD or anxiety or Tourette's, the website latitudes.org has been around for many years, and that can be a great resource for non-drug treatments. The Orthomolecular Society, this is an organization that trains physicians or shares information on treating things with nutrients, treating conditions with nutrients, and they're at orthomed.org. The APA, the American Psychiatric Association, has a caucus, as we mentioned, for integrative psychiatry, and their website is given here. And of course, the Walsh Research Institute has a lot of information on the Walsh protocols, and they are at the website we give right here. Again, we want to suggest that you do not give up. If you try something and it doesn't work, it's best to try something else or try again. Most people who have recovered have tried numerous approaches and failed before they got well. Not all approaches work for all people, so try another. It's always amazing to us how we might suggest that a person try a certain approach, but what ends up working for them is something completely different. And so you should look at what works for you, or what seems like something that might work for you, and follow your ideas of what might work for you, and try them out. You may have multiple conditions, so sometimes you can get a little result or a partial result, but it's not totally gone. So consider that as a possibility. There may be multiple reasons why you have your issues. And of course, not all practitioners are the same. So if one doesn't help you, it's possible that another does. And we don't have it on here, but of course there are psychological issues, of course, our lifestyle issues that may be going on. That you should address as well. Again, learn about your condition and what might be causing it and what can be done to improve it. Many people recover. It's really just a matter of finding out what works for you. And lastly, new research is emerging all the time. You just keep looking and seeing what you can find. So in summary, it's important to review the information on your condition and alternative approaches. You need to review your treatment options and your practitioner options, and then decide on an approach that you feel will work for you, and stick with it long enough to see if it really does work. If that doesn't work, look for another approach and keep working this until you start feeling better. The main thing is keep looking and keep working at it. And we wish you great success on your journey to wellness.